Spotting. This is very light bleeding that occurs outside of a regular menstrual period. It is usually just a few drops of blood, often brown or pinkish rather than the deeper red of a normal flow. Spotting can happen for a number of reasons. Hormonal fluctuations, especially around ovulation, can cause a small amount of bleeding mid-cycle. Starting or switching birth control methods is another common trigger. In younger girls, spotting may occur as the body adjusts during the early stages of puberty, when cycles are not yet fully established. In most situations, occasional spotting is harmless and resolves on its own.
Painful periods, medically known as dysmenorrhea, means severe cramping during menstruation that goes beyond ordinary discomfort. The pain is usually in the lower abdomen and can spread to the back and thighs, sometimes with nausea, headaches, or vomiting. There are two types. Primary dysmenorrhea is caused by high levels of prostaglandins, which make the uterus contract more strongly. Secondary dysmenorrhea is linked to conditions like endometriosis. For centuries, this pain was dismissed as normal, but pain that disrupts daily life or doesn't respond to basic relief is not normal. It deserves medical attention. There's a real difference between typical discomfort and pain that signals something.
Normal period is the kind of menstrual cycle that most health professionals consider typical and healthy. It usually lasts anywhere from 3 to 7 days and comes around once every 21 to 35 days. The flow tends to start light, become heavier for a day or two, and then taper off again toward the end. Most women and girls lose about 2 to 3 tablespoons of blood during a normal cycle, though it can often feel like more. Mild cramping, slight bloating, and minor mood changes can accompany it, and all of that falls within the expected range.
So, light period. This refers to a menstrual flow that is noticeably less than what is typically expected. The bleeding may last only a day or two, and the amount of blood lost can be very small, sometimes barely enough to fill a panty liner. Some girls naturally have lighter periods, and for them, this is simply how their body works. Factors like stress, significant weight loss, excessive exercise, or hormonal shifts from birth control can all reduce menstrual flow.
Heavy periods. Also known as menorrhagia in medical terms, this is when menstrual bleeding is unusually heavy or lasts longer than 7 days. A girl experiencing this might soak through a pad or tampon every hour for several hours in a row, or she may need to use double protection just to manage the flow. Passing large blood clots, sometimes bigger than a coin, is also common. Heavy periods can leave a person feeling exhausted, and over time, they may even lead to iron deficiency anemia because of how much blood is being lost each cycle. The causes vary widely. Hormonal imbalances, uterine fibroids, polyps, and certain blood clotting disorders can all play a role. In younger girls who have just started menstruating, the most common reason is simply that the hormonal communication between the brain and the ovaries has not yet fully matured.
An irregular period means your cycle isn't predictable. Sometimes your period comes before 21 days, sometimes it doesn't show up even after 35 days, and sometimes it can happen twice in the same month. In the first 1 to 2 years, this is normal because your body is still learning to regulate its hormones. But if the irregularity continues for a long time, it could be a sign of PCOS, thyroid issues, or chronic stress. If irregularity lasts for a long time, make sure to see a doctor.
Missed period. Medically referred to as amenorrhea, this is the complete absence of menstruation. There are 2 broad categories. Primary amenorrhea is when a girl has not had her first period by the age of 15 or 16, despite showing other signs of puberty. Secondary amenorrhea is when someone who previously had regular periods stops menstruating for 3 months or more. Pregnancy is the most well-known reason for a missed period, but it is far from the only one. Extreme physical activity, very low body weight, high levels of emotional stress, and certain hormonal conditions can all cause periods to stop. The hypothalamus, a small region in the brain, plays a central role here. It acts as a control center for the hormones that drive the menstrual cycle, and when the body is under significant strain, the hypothalamus can essentially pause the process.